Welcome, future professionals. My name is Jackson. On behalf of Texas barber and cosmetology educators, I am excited to jump in and share information with you on the topic today: temporary hair removal. Let's get started. Body hair removal is not a modern trend. Humans have been removing unwanted body hairs since we lived in caves. In addition to maintaining cultural beauty norms, which often saw body hair as unclean, hair removal could also eliminate certain parasites or mites, or to signify standing in the community. While lasers and waxing are modern inventions, hair removal tools and methods have an ancient history. Our oldest ancestors used sharp rocks or seashells to scrape away hair, while women in ancient Greece would pluck or singe their hair. In Middle Eastern civilizations, sugaring, a precursor to waxing, used a paste of sugar, lemon juice, and water to remove hair from the follicles. This method is still used today, and with a modern emphasis on all-natural products, is even growing in popularity. Depilation is the removal of body hair at the surface of the skin. Common forms include shaving, trimming, or depilatories. The act of shaving, arguably the most common form of hair removal, cuts the hair. Chemical depilatories have a high pH and shouldn't be used on sensitive skin, and usually include as their main ingredient either sodium hydroxide, potassium hydroxide, thioglycolic acid, or calcium thioglycolate. They work by dissolving the hair by breaking the disulfide bond and keratin that give hair its strength, so it can be easily scraped away. Common depilatories include Nair and Veet, and while they aren't often used in salons, a cosmetologist should certainly be familiar with these at-home hair removal products. Epilation, on the other hand, is the removal of the entire hair. Common epilation methods include waxing, tweezing, sugaring, threading, intense pulsed light, lasers, and electrology. Sugaring simply involves a sugar paste that works in a similar fashion to waxing, as hair is removed in the direction of the hair growth. Threading is a form of epilation widely practiced around the world with a long history in many Eastern countries, especially Iran and India. Threading involves a thin thread that is doubled, twisted, and rolled across the areas where hair is to be removed. The thread is able to quickly pull lines of hair at the follicle level. Tweezing and waxing are common salon services that involve pulling hairs out of follicles, resulting in a greater amount of time for hairs to grow to the point that they are visible again. Tweezing is a time-consuming process used mainly for the eyebrows and other facial areas. The procedures for tweezing, sugaring, waxing eyebrows, and waxing other areas will be covered in this section. Before you conduct a hair removal procedure, you should have a consultation with the client to determine his or her desires and whether or not he or she has any special concerns. You should conduct a preliminary examination to determine if there are any contraindications to performing the service. Such contraindications can include, but are not limited to, recent cosmetic surgery, 3 months, recent chemical peel or skin lightening procedures, chronic skin disorders/diseases such as eczema, psoriasis or rosacea, sunburn or fever, blisters, sensitive skin, open and infected wounds or sores like cold sores, varicose veins, pustules/papules, or any other damage to the skin. During the consultation, ask the client about any allergies or medical conditions he or she may have. Also, be sure to ask about any medications that might interfere with services, such as medicines that cause blood thinning, steroids, or prednisone. Clients using any of the following medications should have permission from their physician to participate in hair removal procedures: Accutane, Claravis, Absorbica, or Isotroin. Retin-A, Renovo, or Avita. Differin, Adapalene, Tazorac, or Azalex. Often medications used to treat acne retinoids contain antibiotics which could thin the blood or chemicals that help to exfoliate the skin. If the client is using or has used Accutane, a common anti-medication, in the past 6 months, hair removal should not be performed. Waxing, exfoliation, and peeling treatments should be avoided when taking any of these types of medications, as these procedures could cause painful inflammation and blistering. Eyebrow shaping guidelines. One should know the guidelines that are used for defining the shape of eyebrows through tweezing or waxing. Eyebrows arch naturally, though hair growth above and below the eyebrow may conceal some of the natural curve of the brow. Regardless of facial shape, the ideal beginning of the brow, the point at which the arch peaks and end of the eyebrow, should be oriented according to their position above the eye. The brow should begin above the inside corner of the eye. The arch of the brow should peak just above the outside of the iris of the eye. The brow should end where it intersects an imaginary diagonal line. This line begins at the outside of the lowest edge of the nose and runs through a point at the outside edge of the eye, continuing on to the end of the brow. Now it is time to take your new knowledge into the salon and put it to work. Make sure you take some pictures of your work. On behalf of Texas barber and cosmetology educators, have a great day. See you next time.